Pharmacists will meet you on the first day of your treatment and we will talk to you about your medication. We will also make sure that you're happy with the treatment plan, and if you do have particular questions about side effects of chemotherapy, we can answer those questions as well.
When you're having your treatment in ambulatory care, the Ambulatory Care Unit team will be your main carers, but your nurse specialist will stay in touch and usually come and visit you when you're on the unit. You'll be assessed each day, and the team in the Ambulatory Care Unit will talk to you as to how you're getting on, both physically and sort of psychologically, coping with sort of the travelling and the treatment.
When you come into the Ambulatory Care Unit, there is a dietitian available to see you throughout the time you're there. So what we would normally do is try and come and meet you within the first week or so of your treatment, just to make sure that everything's going okay with eating so far and see if there's any way that we can optimise what you're managing. We would also give advice on food hygiene and food safety, which is a really, really important part of the things we need to consider with your diet.
We'll give you a regime of medication to take at home. This might be quite complex, so there might be quite a few tablets to take with this medication. All we expect from you is for you to be compliant with our directions, so essentially take the tablets as we've directed for you. Don't go off piste and start doing your own thing. It will lead to problems with the chemotherapy. And if you have trouble at home, of course we are always a point of contact that you can get back in contact with if there's anything you need to ask.
We'll try and review how things are going every 2 or 3 days, and the reason behind that is that we know sometimes people struggle with their appetite a little bit whilst they're having a transplant, and so what we try and do is look at what you're managing food-wise and try and optimise that as much as possible, whether that is swapping from having 3 meals a day to smaller meals and snacks. We can give advice on how to make the most of the food you are managing by increasing the calorie and protein intake, and we can also advise on the need to start nutritional supplements if that's necessary.
If you make a mistake at home, don't panic, okay? And don't try to make up for lost doses. Get in contact with us, so either the ambulatory unit nurses or the triage, or if this is overnight, if you might have to contact the ward, you just need to let us know and we will talk you through the next steps and what to do.
There are some benefits for patients who have their transplant under ambulatory care. Undoubtedly one of the biggest is that it allows so much more flexibility and choice with eating. It just gives you a lot more control over when you have those meals and snacks, and there's more access to the food that you like to eat. We also find that it's really beneficial for you to be able to maintain your normal routine with eating. What a lot of patients say to us is because they're a bit more active when they're at home and they're coming in and out of hospital, that can maintain their appetite for a bit longer because they don't feel like they're quite, they're doing a bit more and burning those calories a bit more. Nutrition is really important throughout all treatments for cancer, whether that's chemotherapy or a bone marrow transplant. And there is a lot of evidence to suggest that good nutrition really supports recovery from your treatment and also potentially can reduce length of stay.
Just talk to us. We're very friendly and we're very, very happy to help. And if it means you get a couple of extra days at home that you don't have to spend in the ward environment, I think that's a good payoff. And of course we will keep you safe throughout your treatment.